So, good day, nurses. So, we're here again to discuss the final topic for community health nursing 2, which is the application of nursing process in the care of the community. So, during your second year, first semester, you already what they call this one discuss the application of nursing process in the family naman 'yan. So, meron kang FNCP na tinatawag before. Ngayon naman, dahil ang sakop ninyo or ang nagiging target client ninyo is community, that's why we should now apply it for the community naman. So, again, 'pag sinabi natin 'yan, community assessment. So, gaya din ng ating gaya din ng NCP natin, 'di ba sa NCP natin may individual care tayo, may assessment, diagnosis, planning, intervention, and evaluation. Dito din sa community diagnosis natin or community nursing care process natin, there is also assessment, diagnosis, intervention, and evaluation. Pero sa FNCP natin before, wala tayong diagnosis. Anong meron tayo? It's only the rapay. So ano yung rapay natin? We have the rapport, assessment, we have the planning, intervention, and evaluation. Wala tayong diagnosis sa ating family nursing care plan. So now let's discuss the community assessment, the first phase in the community nursing process. So pag sinabi nating assessment, the data needed to be collected depend on the objectives of the community assessment. In general, the nurse needs to collect data on three categories of community health. Determinants, we have the people, place, and social system. So I already in-underline ko kinolored ko yung what they call this one, yung determinants natin, and in-underline ko siya. So it means very important siya na alamin ninyo kasi lalabas siya sa exam. So again, determinants natin, the people, place, and social system. So sabi dito, assessment, it depends on the objective. So kung ano yung objectives mo, yun lang yung kukunin mo. So the nurse needs to collect data on three categories, yung people, place, and social system. So sa people, syempre, first the demographic profile ng mga tao. So ilan ba yung mga tao dito? Ilan ba sila? Ilan ba ilan ba yung may asawa, ilan ba yung wala, ilan ba yung may trabaho, ilan ba yung wala? And even yung ilan ba yung may sakit. Sa place niya, yung environment. Kailangan mong i-assess yung environment. Yung environment ba ng community na to is prone sa mga sakit. Madumi ba? Hindi ba ganun kaganda? Hindi ba ganun kalinis? We should assess that one. And even the social system. Yung social system niya, isa sa mga factors kasi yan sa determinants ng health. Kaya we should also assess that one. Again, ano yung mga kailangan natin i-assess or the determinants? We have the people, place, and social system. So sa data collected for the health, we have the patch. Ano yung patch natin? Planned approach to community health. So these are the process for health planning. So first, we have the community profile. So sa community profile, kailangan natin ilagay dun demographic data and even the educational and economic status ng ating community as well as the morbidity and mortality rate. Ilan ba yung patient na namatay ng dahil sa ganitong sakit? Ilan ba yung may sakit ng ganito as of the moment? And even the health events such as ano yun, or what including unique health events and even non-health events. Ano yun? We have the typhoon, flood, or yung mga calamities na tinatawag natin. So kailangan din nating i-assess yan. Saan ba dito yung flood prone area? Saan ba dito yung laging nababaha? Ilang ilang beses ba nababaha itong barangay na to every year? So kailangan nating i-assess 'yun, 'di ba? Bakit kailangan nating i-assess yung mga calamities, 'di ba? During flood, anong mangyayari? Nasa evacuation center ang mga tao. So kapag nasa center sila, some or most of them wala silang proper sanitary. walang malinis na source ng water some of the moments, 'di ba? So we should assess that one. Kasi nga para when it comes kapag dumating man yung panahon na 'yan, andiyan agad tayo re-respect at magbibigay ng mga first aid for them. So kung ano yung mga kailangan nila, kailangan na natin i-provide para hindi na natin ma-encounter yung mga sakit na expected nating makikita kapag may mga flood. So next natin, so behavioral data, focusing on risk factors such as smoking, drinking, leading a sedentary lifestyle, and prevailing good health practices in the community such as breastfeeding and regular exercise. So we should also check that one, 'di ba? Ilan ba ang naninigarilyo? Ilan ba ang naglalasing, nag-iinom ng alak? 'Di ba? So ilan ba dito yung mga what they call this one, yung nagpapasuso. So we should also check that one. And pag meron tayong tinatawag na opinion data from community leaders, such as what they think about the main health problem of the community, their causes, measures that may elevate or correct them. So we should also check yung opinion data from community leaders. So, kailangan natin, 'di ba, they are community leaders. Alam nila kung ano yung problema na nasasakupan nila. So, we should also get their opinions. So, regarding dun sa health conditions na na kinakaharap ng barangay nila or ng community nila. For example, mataas ang cases sila ng tuberculosis, and yun yung sasabihin sa'yo ng leader or ng kapitan. So we should also check the opinion data coming from the community leaders. So sa tools in community assessment, meron tayong dalawang data. So we have the primary data and secondary data. Sa primary data natin, meron tayong tatlong tools. Ano yun? First, we have the observation. So, pag from the word observation, ito yung ginagamit natin yung mga senses natin. So, usually, based on the books, apat na sense yung ginagamit natin. We have the sense of touch, sense of sight, sense of hearing, and sense of smell. Yan yung sa observation. Walang sense of taste. Hindi pwede tikman yung mga nasa community. Hindi pwede tikman ng mga community people before ka mag-assess. So, dapat observation, may ocular survey ka. Ano yung ocular survey or windshield survey na tinatawag natin? Yung ocular survey natin, yan yung pupunta ka, di ba, pagpasok mo sa community, di ba sa COPAR natin may ocular visit tayo, pupunta ka lang parang napadaan ka lang sa community. Habang dumadaan ka sa community, tinitignan mo na ang environment niya. Yan yung ocular survey na tinatawag natin. Hindi yung pag sinabing ocular survey, dumaan ka, pumasok ka sa community, nagtanong-tanong ka sa mga tao. No, from the word ocular, 'di ba? Pag gamit lang yung mga ano mo yan, yung mga mata mo lang. Titingin ka lang sa palibot mo, wala ka ng ibang gagawin. You will not ask question. Ocular survey. Yan yung observation. Next natin, we have the information interview. Dito na yan. Yung papasok tayo sa community, magtatanong tayo sa mga community people. So we have key informants here. We have consists of formal and informal community leaders or person of position and influence. So sila yung key informants natin. Consists of formal and informal community leaders or person with the position and influence. So sino to? Ito yung mga barangay officials natin. Sama mo ng mga SK officials natin. The BHW. So sila yung mga key informants natin. And we have the community forum. Ano tong community forum natin? Kung meron kayong barangay assembly sa inyong mga barangay. So yan yung mga barangay assembly niya or pulong-pulong na tinatawag. So yan ang ating primary data. Sa secondary data natin, these are the health records. So these are the health records and report. Ano ito? Ito yung mga tinatawag nating FHSIH. So ano ba yung FHSIH? Ito yung Field Health Service Information System. So ano ba yung mga, bakit ba Etong FHSIS natin, these are the priority setting by the local governments. So, ibig sabihin dito nangyayari yung planning and decision making at different levels of barangay, municipality, district, provincial, and national. So kapag sinabi natin FHSIH is monitoring and evaluating health program implementation. So in short, ito lang ang purpose ng FHSIS natin, to record, monitor, report, and summarize. So again, yun lang ginagawa natin. Yung sa FHSIS natin, it records, monitor, so record, monitor, report, and summarize of health services. So yan lang ang ating tinatawag na FHSIS. So gaya nga ng sabi ko kanina, kung ang purpose niya is to report, record, monitor, and summarize of healthcare services, isa lang ang ibig sabihin niyan. It is a inventory. Inventory siya ng ating mga community health services. Ilan ba ang mga tao na nagpa-check up ngayon sa RHU? Ilan ba yung kumuha ng TB treatment? Ilan ba yung nag-avail ng ganitong services? Ilan ba yung nakakuha ng ganitong gamot? Ilan ba yung nagpa-test for HIV? Ganyan lang yung mga inventory. So, ganyan ay makikita natin sa FHSIS. So, ngayon, sa ating FHSIS, meron tayong actually apat ata to. Apat. So, may apat tayo dito. Apat yeah. Oh my gosh. Individual, target client list, 3, 4, 5. Should be 6, 7. So, 7 ta. So, 7. So, first sa ating FHSIS, meron tayong tinatawag na individual treatment record or the family treatment record. So, pag sinabi nating family treatment record or the individual treatment record, this is the kinatawag natin na fundamental building block of FHSIS. Fundamental building block of FHSIS. So, itong ating itong ating family treatment record or the individual treatment record consists of names, age, age, gender ng ating patient. So yan yung ating individual treatment record. So ito, pag sinabi nating individual treatment record, a document or form or piece of paper upon which is recorded the date, name, address of the patient, presenting symptoms or complaint of the patient on consultation and the diagnosis, if available, and the treatment and date of treatment. Yan yung makikita natin sa individual treatment record. How about naman kapag target client list? Pag sinabi nating target client list, the tool enables the midwife or the nurse to plan and carries out patient care and service delivery. Such list will be considerable value to midwives, nurses in monitoring service delivery to groups of patients identified as target and or eligibles for a particular health program or also facilitate the monitoring and supervision of service delivery activities report service delivered. So ganito lang yan, ang pinagkaiba ng ating individual treatment record and target client list from the word ay individual or the family treatment record. Ito ay yung mga ang mga laman niya is yung demographic, history taking, assessment, and yung mga treatment ng pasyente mo. Pero pag target client list, ganito yan. Kapag hindi mo alam, for example, may patient ka, hindi mo alam ang diagnosis niya, kunin mo ang individual treatment record. Pero pag same patient yan, kunyari yung patient mo may tuberculosis na, so kapag may tuberculosis na siya, lumapit ulit siya sa'yo, syempre may treatment pa rin siya ng tuberculosis, ang kunin mo is the target client list. Ito target client list for prenatal care, postpartum care, under 1-year-old children, family planning for children, ayan natural tuberculosis program, and national leprosy program. So basta lahat ng DOH program, ito yan target client list. And then pag individual treatment record, ibig sabihin individual. Name mo, age mo, date na nagpunta ka, ano ang treatment mo, anong history mo, anong complaint mo. So yan, individual treatment record. Again, kapag once na pumunta sa yung patient, hindi mo alam ang diagnosis, anong kukunin mo? It's individual treatment record or the family treatment record. Pero pag pumunta yung patient mo, same ang kanyang sakit, anong kukunin mo? Target client list. So, nagets natin. So, next natin, we have the summary table. So sa summary table natin, form with 12-month columns. So form with 12-month columns retained at the facility such as the barangay health station where the midwife records all the monthly data. Sa summary table natin, accomplished by midwife. So ito yung naiiwan sa barangay health station natin. Dito nire-record lahat ni midwife ang mga services in 1 year. And then, we have the monthly consolidation table. Pag sinabi natin monthly consolidation table, the public health nurse records data from all barangays. And then, this is the source document of the nurse for the quarterly form. The, the, the monthly consolidation table serve as the output table of the RHU as it already contains the listing of indicators by barangay. So again, di ba, sa ating barangay station, sinong nandoon? Si midwives. Bihira lang tayo makakita ng nurse sa ating barangay health station. Laging si midwife ang nandun. So ngayon, pag nandoon siya sa barangay health station, anong gamit ni midwife natin? The summary table. Doon niya nilalagay lahat or ng reports niya sa summary table. Ngayon, pagpunta natin sa monthly consolidation form, sinong gagawa nito? Si nurses. Si nurses. Si nurses ang gagawa nito. Bali, ang laman ng ating monthly consolidation form, record naman ito ng lahat ng barangay. For example, here in Tugigaraw, we have, I think, 49 barangay. 49, 40, basta ganyan, around 40 plus. So, ibig sabihin, itong monthly consolidation table, di ba, quarterly kasi ang kanyang report. So, ang gagawin ni nurse every month, ang gagawin niya kukunin niya na yung mga record in health in all barangays here in Tuigaraw. So, kapag natapos na yun, meron na siyang monthly consolidation form. And then, pag monthly form naman is regularly prepared by the midwife and submitted to the nurses. So, meron tayong M1 contains indicator categorized as maternal care, child care, and family planning. And we have also the morbidity report. So, pag M form natin or the monthly forms, the same indicators found in the target client list. So parehas lang siya pero ito lang kasi nakakategorize siya, 'di ba? So in M1, the midwife should copy the data from the summary table to the monthly form which she regularly submits monthly to the public health nurse. So we have the M1 and M2. So So listen, ito yung mga monthly form contains selected indicator as categories. Ito yung monthly forms natin. So we have the maternal care, child care, family planning, and disease control. Pag quarterly form is the municipal naman. 'Di ba? Ito yung municipal natin. Pag what do you call this one? Quarterly forms, these are the municipal or city health report and contains the 3-month total of indicators categorized as maternal care, family planning, child care, dental health, and disease control. So yan yung ating quarterly. So ito para din siyang TCL or the target client list. Pero dito, meron siyang specific na kakategorize siya. So, yan yung ating. Then, aside from that, we have the annually form. So, meron tayong A1 na tinatawag. So, annual form prepared by the nurse and is the report of the RHU or the health center. It contains demographic and environmental data and data on natality and mortality for the entire year. So, pag annually form consists of data and indicators needed only a yearly basis. So, from the word annual form, annually lang siya ginagawa. And then itong ABHS or demographic and environmental. So ito yung tinatawag nating form is the report of midwife which contains data on demographic, environmental, natality, and mortality data. Yan yung ABHS natin. So, yung annual form 2 natin, ito, annual form 2 si letter C. Si annual form 2 natin is the report that lists all diseases and their occurrence in the municipality. The report is disaggregated by age and sex. So, ilan yung may sakit ng ganito, ng TB, ilan ang babae, ilan ang may sakit na lalaki, 'di ba? Ilan yung may TB na 5 to 10 years old, 16 to 20, parang ganun. So, ito si Annual Form 2 or CA2. Si Annual Form 3 naman is the report of all that occurs in the municipality. So, ganun din siya. Naka-arrange siya from age and sex. So what I think nakaayos siya. Ilan ang namatay na babae ngayon, ilan ang namatay na lalaki ngayon. Ilan yung namatay na age na ganito, ilan yung namatay na age na ganito. So same lang si Annual Form 2 and Annual Form 3. Kaso lang ang pinagkaiba lang nila si Annual 2, ito yung report ng disease. Annual Form 2, disease, and then pag Annual Form 3, mga death cases. Pag si Annual 1, si A1, ito yung consists of yearly basis report. And then EBHS, demographic, the environmental, natality, and mortality data of the community. So yan yung ating mga reporting forms na under sa ating FHSIS. Next, proceed tayo. Tapos na tayo sa assessment. Natapos na natin si primary and then si secondary. Now, proceed na tayo sa community diagnosis. Sa community diagnosis natin is the process of determining the health status of the community and the factors responsible for it. Hindi ito yung katulad na di ba? Hindi ito yung diagnosis yung nasa NCP natin. So usually, madali lang sa natin sa what they call this one sa community diagnosis natin. Pero hindi tayo kagawa dito ng community nursing care plan kasi wala namang ganon. So, in this phase, the health workers makes a judgment. So, wait lang. In this phase, the health worker makes a judgment about the community health status, resources, and health action potential. Ano yung mga factors natin? We have the health risk or specific problem to which the community is exposed. The specific aggregate or community with whom the nurse will be working to deal with the risk or problem. So related factors that influence how the community will respond to the health risk or problem application of the nursing diagnosis. So usually sa ating community diagnosis, ito yung naka-ano, parang it depends upon the assessment of sa assessment natin. For example, ano yung problema ba talaga na nangyayari sa community? Ano ba yung maraming mataas na cases ngayon? Ano ba yung maraming mataas? So, ano ba yung parang sakit ba ang problema nila ngayon? Sanitation, or waste and disposal. So ganyan, it depends upon our assessment. So depende sa specific problem and then kung ano yung mga aggregates or community whom the nurse will be working to deal with the risk or problem. And aside from that, you influence how the community will respond to the health risk. So, it depende din kung paano ba mag-respond yung community dun sa problema. They are passive or active recipient of care ba? So, kailangan makita din natin yun. So, yan yung community diagnosis. Pag sinabi natin community diagnosis, eto lang i-remember nyo. Determining the health status of the community and the factors responsible for it. So, yan lang si community diagnosis. The next, we have also yung tinatawag natin na planning. So, tapos na tayo sa assessment, diagnosis, now punta tayo sa planning. Sa planning, I think community health interventions, planning community health interventions, as in other field of nursing practice, planning for community health intervention is based on the finding during assessment and formulated nursing diagnosis. So same lang to. Same lang, same lang siya, 'di ba? Parang sa NCP natin, yung planning natin is based sa, 'di ba, yung planning natin for intervention is based assessment natin. So 'di ba kunyari ang assessment natin sa NCP natin may fever siya. Alangan naman mag chest physiotherapy ka eh fever yung yung nakuha mo or yung na-assess mo. Or aside from that, sabihin natin, yung patient mo is, balik tayo ulit sa fever. Tapos ang planning mo sa kanya after 3 hours of nursing intervention, the patient breathing, 'di ba? Breathing pattern will become normal. So, parang ganyan. So, hindi pwede. It depends upon our assessment. So, yung planning natin, nakadepende yan sa assessment natin at sa diagnosis natin. So, parang ganun lang din sa NCP natin. So, kung ang assessment natin, nakita natin na walang proper drainage and disposal yung mga patient, yung mga community people. So, anong gagawin mo? Yung planning mo dapat ganun, di ba? So, sabihin mo ang planning mo after 1 week of nursing intervention in the community, the 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 community people learn on how to segregate their waste as well as creating a temporary drainage for their own houses. So, parang ganyan lang. So, yung planning natin nakadepende sa ating community assessment and community diagnosis. So, sa planning phase natin involves priority setting. So, formulating goals and objectives and deciding on community intervention. So, mayroon tayong active participation of the people to foster participation in the community should have genuine representation in the planning group. Decide on community representative will be facilitated in the committee has been organized earlier. So sa priority setting natin, ito lang. Alalahanin niyo lang yan. Provides the nurse and the health team with a logical means of establishing priority among identified health concern. From the word itself, priority setting. So sa priority setting, dito na tayo nagpa-prioritize ng mga health problems. So sa community, hindi lang isa ang problema dyan. Maraming problema sa community. Kaya anong gagawin mo? doon sa problema. Hindi naman natin kayang pagsabay-sabayin na i-resolve yung problem nila. So, kailangan one at a time lang. 'Di ba? One at a time lang. So, kung sino yung pinakamalala, yung sa tingin nila na yun talaga ang problema, siya ang i-prioritize mo. That's why, sa priority setting, dito natin ma-identify or we should identify kung sino yung bibigyan natin ng pansin. Bibigyan or yung ipa-prioritize natin na bigyan ng or i-resolve yung kanyang problem. So, kunyari, ang problema, we have the proper disposal, we have the increased tuberculosis, maraming namamatay because of, sabihin natin, dengue. So, kailangan, for example, ito yung mga tatlong example na problema na nasa-face ng community ngayon, identify natin sino yung priority ba dapat siyan. So, walang disposal, walang proper drainage, pwede, di ba? Pwede dahil kaya mataas ang dengue death cases nila nang dahil dito. So, kailangan i-resolve natin itong proper disposal para maiwasan din natin yung pag-increase ng mga death ng casualty regarding dengue. So, dalawa ang ma ma-resolve mong problema kapag once na prioritize mo ang proper drainage and disposal. And then, to be followed na lang si tuberculosis. So, ganyan mag-prioritize ng problem. Ito tawag nating priority setting. Then, we have the, ito na, criteria to decide on a community health concern for intervention according to the World Health Organization. So first, we have the significance of the problem. The significance of the problem is based on the number of people in the community affected by the problem or the condition. So sa significance of the problem, titignan lang natin ilan ba yung affected, ilan ba yung ilan ba yung tao na may sakit na ganito as of the moment, ilan ba yung cases natin. So, ganyan lang yung titignan natin sa significance of the problem. If the concern are disease condition, this may be estimated in terms of its prevalence rate. So, gagamitin nyo na naman yung inyong what we call this one, computation natin na na-discuss natin during our prelim. 'Di ba? Yung may mga compute tayo, yung times 1,000, 'di ba? Na naalala yun? Prelim ba yun or midterm? 'Di ba? So, pag sinabi natin prevalence rate, ano yun? The total number of cases of a disease in a population, 'di ba? So, yun, total number of disease. So, tingnan natin prevalence rate niya. And then, pag potential problem, its significance is determined by estimating the number of people at risk of developing the condition. Titignan natin, for example, sa COVID-19, di ba? Ngayon sa COVID-19 disease condition, ilan ba yung cases, number of cases? And then, potential problem, anong titignan natin? Tignan natin kung sino yung mga nakasalamuha niya. Titignan natin ilan ba yung mga nakasalamuha ito. At yun ngayon yung titignan natin. So, yun yung magiging potential problem natin data. Potential problem data natin regarding COVID-19. So, ganyan lang yung significance of the problem. Next, the level of community awareness and the priority its member give to the health concern. Wait lang. Major consideration related to the priority that the community gives to the health concern. So again, pag sinabi natin number, the level of community awareness, yan lang yung magiging key natin. Community awareness. Diba? So titingnan natin community awareness. So first natin, we have the significance of the problem. And then next natin, we have the community awareness. Di ba? And then, pag community awareness, ito yung parang titingnan lang natin if they are aware, di ba? The individual, kung aware ba sila sa mga issues and concerns, di ba, ng problems na kinakaharap ng community nila as of the moment. So, yan yung community awareness. The next natin, we have the ability to reduce the risk, di ba? 'di ba? Alam na natin na-identify na natin yung problem, na-identify na natin yung risk factors. May kakayahan ba sila na i-reduce yung risk na yun? For example, 'di ba, sabi natin ang na-prioritize natin kanina is yung disposal, waste disposal dahil may improper drainage sila at dahil may improper disposal sila and then improper drainage. So ano nangyari? Tumaas din ang dengue cases nila. So ngayon, 'pag na-resolve natin, na-identify natin na dahil siguro sa waste disposal yun. So ability to reduce the risk. Wait lang. Ngayon, na-identify natin yun yung problem nila. May kakayahan ba sila na i-lessen yung risk na yun? So ano, paano ba? Paano? How? 'Di ba? Kaya ba nilang maglinis? Kaya ba nilang mag-segregate ng basura nila? Kaya ba nilang gumawa ng temporary canals nila? So yan yung mga gagawin natin. Involves the team of influence in decision making related to action in resolving the community health concern. Hindi lang dapat kayo. Hindi lang dapat ang community people ang nagde-decide on how to resolve or to reduce the risk. Dapat ito ay dalawa. Team dapat ito. So dapat both the team, the health workers and the community people, dapat both of them nagde-decide on or nagtutulungan when it comes to decision making. The next, we have the cost of reducing risk. The nurse has to consider economic, social, and ethical. Again, pag sinabi natin cost of reducing risk, the nurse has to consider economic, social, and ethical requisite and consequences of planned action. So, kailangan natin consider cost of reducing risk. Diba? May kakayahan ba, diba, economically, socially, and ethically? Kaya titingnan natin, resources. So, kaya bang magtulungan ng mga community people? Cost of reducing risk. Next, we have the ability to identify the target population, where the intervention is a matter of availability of data sources, such as the FHSIS, census, survey reports, and the case finding or the screening tools. Kailangan natin yung mga data, yung mga assessment natin. We have the secondary data natin. Kailangan natin yun sa ability to identify the target population. And next, we have the availability of resources to intervene the reduction of risk entails technological, financial, and other material resources of the community, the nurse, and the health agency, di ba? Hindi naman 'di ba? For example, yung sa problem na identify natin, disposal and then improper drainage, 'di ba kailangan natin ng materials dun. Kailangan natin ng financial support. Kailangan natin pambili ng basurahan, kailangan natin pambili ng mga garbage bin or yung mga trash bags. Kailangan natin yun. Or aside from that, pagkaroon ulit ng paggawa ng drainage. Kailangan natin ng pera dun. Kailangan natin ng budget for that. Kaya nga, availability of the resources. The next, formulating goals and objectives. So what's the difference between goals? So goals, sabi dito, are the desired outcomes at the end of intervention, whereas objectives are the short-term changes in the community that are observed as the health team and the community works towards attainment of goals. Ang objectives serve as instruction defining what should be detected in the community as interventions are being implemented. Specific, measurable, attainable, relevant, and time-bound. Then C, smart natin. Objective provide a solid basis for monitoring and evaluation. So, yan lang siya. Goals natin, yan yung gusto nating makuha. And then objective natin, these are the instruction defining what should be detected in the community intervention. Next, Deciding on community intervention. Kanina goals and objectives, tapos na din natin ang planning. Ngayon naman sa intervention na tayo. The group analyzed the reason for people's health behavior and directs strategies to respond to the underlying causes. For example, the reason for preference of home delivery over facility-based delivery should be identified. If the majority of the women would choose to have a home delivery because of cost or lack of access of birthing facilities, strategies should then be focused on improving facility-based services. But if the primary reason is sociocultural and planning team may opt to concentrate on providing opportunities for skills development or traditional birth attendance and are exerting effort to gain the trust and confidence of the women in their families. In the process of developing the plan, the group takes into consideration the demographic, psychological, social, cultural, and economic characteristic of the target population on the one hand and available health resources on the other hand. Sa community intervention natin, okay, sa community interventions natin, hindi lang dapat kung ano yung alam natin na intervention. Kung alam natin, tama ito, kailangan ito yung gawin natin. We should also we should also consider yung demographic ng ating community, 'di ba? Kasi may mga, 'di ba, for example, sa ating mga cultural, 'di ba, may mga beliefs and practices, bawal 'yan. So we should also check that one para kahit papaano hindi natin napapakialaman yung kanilang mga practices, mga cultural nila. Then aside from that, yung demographic, the social, 'di ba? Yung psychological and even the resources. Tignan natin, kaya ba ng ano dito? For example, 'di ba, hindi naman gano'n kayaman yung community, ta's gusto mo magpabili ng machine. Hindi naman afford ng community 'yun. So kailangan we should also consider their resources, the availability of the resources before deciding for intervention. So, yan ang ating community intervention. The next, evaluation. So, sa evaluation natin, approaches may be directed, structure, process, and outcome. So, structure evaluation involves looking into the manpower. So, ang ating keyword lang dito, manpower. Pag nakita mo na si manpower sa question, structure evaluation. Pag process evaluation naman yan, assessment, diagnosis, planning, implementation, and evaluation were undertaken. So buong process ng NCP natin, yaan, kaya nga process evaluation. Lahat ng process ng NCP natin or the phases ng NCP natin nandiyan. Process evaluation. Yan. Pag outcome evaluation, attainment of goals and objectives. Na-attain mo ba yung goals natin? Nakuha ba natin yung target natin? And kapag ongoing evaluation, monitoring is done during implementation to provide feedback on compliance to the plan. So mag-keyword lang kayo, masasagot nyo yung mga exam natin. So, next natin, standard of evaluation. Sa standard of evaluation, the base for a good evaluation, the basis for a good evaluation are its utility, feasibility, propriety, and accuracy. So pag sinabi natin utility, it is the value of evaluation in terms of usefulness. So usefulness, di ba? Utility, usefulness, nagagamit ba siya? So yan yung ating utility, feasibility, whether the plan for evaluation is doable or not, considering available resources. Propriety involves the ethical and legal matters, respect for the worth and dignity of the participants. And accuracy refers to the validity and reliability of the results of evaluation. So yan lang yan. Again, meron tayong UFPA, 'di ba? UFPA, utility, feasibility, propriety, and accuracy. So that's all for our final topic. So now review tayo. So what the nurse has been doing is a system which provides a summary on health services delivery at the barangays, municipal, district, provincial, regional, national levels. This is a FHSIH or the Field Health Service Information System. Next, which of the following components stated above is being produced at the provincial health office based from the data reported by the local RH of the community? It's output report. O, di ba? Sabi natin kanina, di ba? Si target client list, si individual treatment record galing sa RHU and then pupunta siya ngayon, gagawan siya ng report papunta ng provincial and then siya na si output report. Then, the components of FHSIS said to be as the second building block. Sino yung primary building block natin? Si individual treatment record or si family treatment record. Ang second building block natin sino? Si target client list. Second building block yan. Again, anong difference sila? Kapag once na naghahanap or hindi mo alam yung diagnosis, anong kukunin mo? Target or the individual treatment record. Pero kapag pumunta sa'yo, same yung patient. For example, may TB siya, ano kukunin mo? It's the target client list, which is the second building block of the FHSIS. The introduction of standardized client lists maintained in hardbound cover is designed to result in permanent records of facility healthcare delivery activities, which can be served as a facility-level database. The complete set of lists will be collected when, kailan, end of each year. So, end of each year, kukunin or kukolect yung all of the data. Next natin. What is the purpose of the community diagnosis in the planning process? To assess the community's health status and factors influencing it. So yan, what is the purpose? To assess the community health status and factors influencing it. In priority setting, what does the World Health Organization consider as a major criterion for intervention? It's the community awareness. So again, that's the major criterion for intervention according to WHO. Next, what is the primary role of the nurse during the implementation phase of community health intervention? Ano yung ating primary role? Facilitate the process of intervention. So yan lang yung magiging role natin to facilitate the process of intervention. Next, which type of evaluation involves examining the manner by which assessment, diagnosis, planning, implementation, and evaluation were undertaken? It's the process evaluation. Di ba? Na ano natin yung kanina, process evaluation basta pag may NCP. Diba? Next natin. What is the primary focus of ongoing evaluation during implementation? It's monitoring the compliance to the plan. That is the primary focus of ongoing evaluation during implementation. What does feasibility address in the context of evaluation? Whether the plan is doable with available resources. The next, in the community diagnosis, what does the health worker determine about the community's health status? Resources available. Resources available in the community diagnosis. What is the primary purpose of morbidity and mortality data in community assessment? Understanding the health status of the community. Bakit kailangan, di ba? Pag once na mataas ang mortality and morbidity, ibig sabihin madaming cases, madaming namamatay lang dahil sa cases, that's the health status of the community. Ibig sabihin hindi maganda yung kanilang health status or the situation ng community na yun dahil mataas ang kanilang mortality and morbidity rates. What type of assessment focuses on a specific aspect of health that the community has in mind? So ano yun? It's the problem-oriented assessment. Which of the following is an example of community behavioral data collected during community assessment? It's the opinion data from community leaders. What is the significance of the problem as a criterion for priority setting? It is based on the number of people affected by the problem. And what is the primary focus of the annual Form 2 in the FHSIS? Yearly morbidity report by age and sex. Who are considered key informants in community assessment? Key informants natin, sino ang key informants ulit natin doon? Wait lang. Who are considered the key informant? It should be no class. It should be the community leaders, not health workers. It should be community leaders, not health workers. Next, what is the purpose of the target client list? What is the purpose of the target client list? Ng target client list to record the individual treatment history. To record individual treatment history. Which phase of the patch process involves active participation of the community and the goal formulation? It's the planning. As a patch natin, sa planning yan. And then, what does the nominal group technique facilitate during priority setting? Flexibility and equal voice in decision making. Which type of data is collected through an ocular survey during community assessment? Environmental data. Then what is the role of the nurse during planning phase of the community health intervention? What is the role of the nurse during the planning phase of community intervention? Facilitate the process of goal formulation. Facilitate the process of goal formulation. Then, how are goals and objectives different in community health planning? How are goals and objectives different in community health planning? Goals are long-term outcomes, objective are specific, short-term changes. So yan yung difference nila. In the community diagnosis, what is the role of related factors? And identifying the health risk. Identifying the health risk. What is the primary purpose of anti-consolidation table? To monitor and evaluate health program and implementation. To monitor and evaluate health program implementation. The data needed to be collected depends on the objectives of community assessment, community planning. It's community planning. It is a process of determining the health status of the community and the factors responsible for it, community diagnosis. It involves priority setting, formulating goals and objectives, and deciding on community intervention. It's planning phase. It's a planning phase. It is focused on a particular aspect of health, focusing on what's problem the communities have in mind. It's problem-oriented assessment. Problem-oriented assessment. In collecting primary data, what will you use for ocular survey or the windshield survey? We have observation. Observation ang gagamitin natin for ocular survey. Then, in collecting primary data, what will you use? Tapos na. Tools in community assessment. What can the nurse find in the secondary data source, health records, and reports? In reporting form in FHSIS, what forms can regularly be prepared by the midwife and submitted to the nurses? We have the monthly forms. The monthly forms. In reporting forms in FHSIS, what forms can be prepared by the nurse? Annual form. Annual form naman for nurses, and provides the nurse and health team with the logic means of establishing priority among the identified health concern its priority setting. The desired outcome at the end of the intervention, whereas objectives are the short-term changes in the community that are observed as the health team and the community work towards the attainment of goal is goal. Di ba? May attainment of goal, it's goals. The Field Health Service and Information System is the recording and reporting system in public healthcare in the Philippines. The monthly Field Health Service Activity Report is a form used in which the component of FHSI is the tally report. To monitor clients registered in long-term regimen, such as the multi-drug therapy, which component be most useful or multi-drug therapy daw? It's the target client list. Which of the following is used to monitor particular group that are qualified as eligible to certain program of DOH? Ano yan? Program daw. Target client list pa rin. In using the tally sheet, what is the recommended frequency in tallying activities and services? Daily. Sa tally sheet natin, it should be daily. When is the tally sheet done? Every at the end of the day. So at the end of the day, bakit daily siya? Kaya at the end of the day siya gagawin. Target client list will be transmitted to the next facility in the form of output record. Output record naman. Then, this is the only mechanism through which data are routinely transmitted from one facility to another. Family treatment record, di ba? Yan lang yung nata-transfer. Kaya punta yan sa barangay health center, dalhin sa RHU, pag di kaya sa RHU, dalhin sa primary hospital or sa pinili mong hospital. Then, what is the primary advantage of having a target client list? Help monitor service rendered to client in general. FHSIH, the QT or the report form environmental health activities is prepared how frequently? Quarterly. Diba yun na? O Q3, quarterly. What should the PHN do if committed errors on her documentation? Ano dapat gagawin? Draw a line through the error, write the initial, and the line, and the date, and date the line. So again, draw the line through the error, write the initial, and date the line. All but one is standard of documentation in public health, and these are to be factual, complete, accurate, and opinionated. Bakit siya naging mali? Opinionated. Diba? Dapat, ano yan, hindi dapat opinionated yan. Which among the following is a reporting tool component of FHSIS? It's the consolidation table. Is a reporting tool component. Which, wait lang, parang may mali doon. Check ko muna. Sorry. Yes, it should be consolidation to form. Tama. The following should be observed in accordance to the standards of documentation. Never document for someone else or sign another nurse name. Ba? Wag na wag gagawin yan kapag kayo ay professional nurses na. Bakit? Para maging or para ano, to protect, di ba? Never document for someone else. Hayaan mo pa siya. Kasi mamaya, mali pala yung ginawa niya, hindi niya pala nagawa, di ba? Nadadamay ka pa. Kaya never document. This refers to standard evaluation, whether it's doable or not, considering the responsible may doable dyan. It's feasibility. It's feasibility. Then, this refers to the validity and reliability of the resources, or reliability, accuracy. Then, aside from the technicalities of evaluation, the result of evaluation should be truthful, reported, give credit to whom it's due, and to the show the strength and weaknesses of the community. It's the propriety, diba? And it is the value of evaluation in terms of usefulness. It's utility. This is the evaluation of manpower. May manpower na tayo. It's structure. And then, process of evaluation is focused on what area of evaluation, manpower and physical resources of the agency for interventions. And this is an evaluation approach that is focused on the degree of attainment of goals and objectives, its outcome. And the significance of the problem in priority setting is based on number of people affected in the community. What are the three categories of determinants in community health assessment? It's the people, place, and the social system. And that's all for our final topic for community health nursing 2. So God bless on your examination, future nurses.